AdvoKAYte, holding healthcare accountable. This podcast is my way of sharing what I've learned about the mistakes, the cover-ups, and the ways we can all protect ourselves. We're all in this together. Hi, everyone, and welcome back to AdvoKAYte, holding healthcare accountable. I'm Kay Van Wey, your host. I'm so excited for Season 2. You know, in Season 1, we really focused on an extreme example of what can go wrong when systems fail. And that's the Dr. Death case. But Season 2 is going to be focusing on people whose lives didn't make the national news. These are the kinds of cases that Luke and I deal with day in and day out in our practice of representing real patients. But more importantly, we're going to be talking about the things that we know as insiders, so to speak, which is that we're not just dealing with the occasional bad doctor, the occasional sociopath like a Dr. Death, or the occasional bad nurse. We're talking about a healthcare system that is broken. We have the most expensive and the most sophisticated healthcare system in the world. We pay more for our healthcare than any other country in the world. And we live in the richest nation in the world, and yet we fall far below other nations in terms of our outcomes. But it's not because we don't know how to fix it. It's because the profit-driven system has not been properly incentivized to fix it. So without further ado, I'd like to say that my wonderful, brilliant law partner, Luke Metzler, is my first guest. Welcome to Season 2, Episode 1 with Luke Metzler. Luke, thank you for dropping everything you're doing in your personal and professional life and coming back into the podcast studio to talk to me today.
I love doing it. This is great. I'm glad you asked me back.
Well, anytime, you come back anytime you want, and then maybe we'll switch the seats and you can interview me.
All right.
Fair is fair, right?
Yeah, that's right.
So, you know, one of the things that I enjoy about you coming here is that you and I do not have the luxury of sitting down and just talking. You know, we're just running like two, you know, what's out of hell and all day, every day. At one point, we were going to try to go to lunch, you know, once a week or something, and that didn't happen. But
it's impossible.
Yeah, it's nice to have you here, Luke.
Yeah,
really.
Thank you very much.
So, what I want to do on this episode is kind of talk about the bridge between Season 1 and Season 2. You know, Season 1, we started all about Dr. Death. The reason that we did that is because Dr. Death is sort of a household name to a lot of people. And it wasn't a retelling of Dr. Death. It was a reminder of all of the system failures that gave us a Dr. Death and why that's important today, because we know the system problems existed long before Dr. Dunch came along. None of the problems ever got fixed. And what that means for all of the people whose cases don't make the national news or don't become a household name.
Yeah, and you know, it's great that it's framed that way, because Season 1 really showed you the extreme result, but also dug into kind of the major themes of system failures that lead to that result. And what I really like about the plan for Season 2 is it broadens it out in a sense to not just that one catastrophic case, but brings it down to also here's how that plays out in other types of cases and other areas of medical malpractice and in medicine, and really kind of highlights what it's like for the families that we see every day, to make sure that everybody kind of understands how these broad system failures really play out in everyday life.
Well, it's really so true. And there's so many commonalities that we see and experience so many of these situations with our clients. that don't make national news, but there's oftentimes a common root cause for why these catastrophes occurred. And, we want to spend a lot of time talking about that because to the extent that any catastrophe can be avoided in anyone's lives, we want that to happen.
Yeah. So, you know, what's your biggest take on the difference between season one versus season two that listeners can expect?
Well, season one was the story of a few patients' journey, um, patients who did everything they knew to do. They checked their doctor on the Texas Medical Board, the internet, looked at the Google reviews. Many of them got a recommendation from a doctor they trusted that said, "Hey, there's a new young hotshot neurosurgeon in town. Go check out that doctor." And they literally, walked into a saw blade unknowingly. And they went from doing their lives as normal to the very next day, everything in their lives had changed. And this is what I want to talk about more. It reminds me of how you and I do talk about take a catastrophically brain injured baby, for example. That baby becomes a teenager, becomes adult, becomes a grown man or woman that's still requiring 24/7 care. And nobody's doing a documentary on that, but yet we see that day in and day out.
Yeah. So, uh, you know, some of the stories you're going to be talking about through a bunch of great participants this season. I've seen part of it. I know that you've got a million more people you're adding to the list every day. Some thought leaders in different areas of medicine and law, and a lot of kind of real world examples of this stuff. Why is it important for you in season two to kind of broaden that lens? And what do you think that listeners can gain from the individual stories that they're going to get in season two that you can't really get from the season one focus on, Dunch and Dr. Death and kind of the broad system failures?
Well, it's not just theory, and it's not just an interesting story. One of the reasons that the Dr. Death cases got so much attention is they cast it as a true crime story. And so it's more about things that are happening that are not being talked about. It's more of an insider's view of what's going on in healthcare that is affecting all of us. Um, so I could give you a lot of examples of the kinds of things we're talking about and the kind of guests I'm going to have.
Well, obviously, Dunch, Dr. Death, there are instances occasionally that kind of catch fire with the media, catch the attention of the public. But we see catastrophe day in and day out, and you hardly ever hear about that in the news. You hardly ever hear that talked about on the streets or even with your friends and family. Uh, what do you think causes there to be such a disparity in these high, publicity cases, and why the everyday catastrophe that we see really goes unheard?
Well, it's like a lot of the news that gets filtered down to us these days. Can it be packaged into a 30-second soundbite? Can it be packaged into a 2-minute clip on a news show? And the truth is that some of these things need to be more deep dive type conversations. Plus, no one's really seeking out a human factors engineer to talk about why human error exists. And I think people will find it very interesting. People ask me, well, who is your audience? Like, why are you doing this and who's your audience? And I'll answer it this way. Why are we doing this? Accountability is picking up the pieces after catastrophe has struck. And that is our profession and our craft, which is how to prove the case. What experts do we need to hire to prove the liability? What experts do we need to hire to prove the lifelong financial ramifications on the family? The podcast is about, hey, look, we're all in this boat together. And given our industry expertise, let's bring our own expertise as well as go out and get other experts in the industry to talk about what needs to change, what technology is available, what science is available to prevent errors from happening. What does the future look like for patients? We're living in an age of AI. We're living in the time of greatest change in our country's existence. So I would say the podcast is for everyone because we're all patients and everyone should seek to educate themselves about what's going on in our healthcare system that puts us all at risk.
Okay, so I don't want to bury the lead here. I'm going to be the first guest of this season. Uh, I'm not sure why, so tell us why. And then also tell us a little bit more about what we can expect from season 2.
Well, Luke, you're my first guest on season 2 because you're my favorite, without a doubt. And I can count on you to be smarter than me and say much more intelligent things than me. But I want to kind of talk about what's ahead in season 2, what guests we already have that are coming, sort of the topics that we're going to be talking about. But I want you to help me bring it home. I want you to bring it back to, well, that's real interesting, Kay, about human factors engineering or whatever, but how does that apply to me? How does that apply to everyday patients? So that's what I want to talk about.
Oh, that's going to be a lot of fun.
Yeah, absolutely.
So, without letting everybody know, the names of all the guests and exactly what's going on, tell us the kind of major themes that you're going to be exploring in season 2.
Well, the major themes are, we're going to begin with sort of the hospital governance. And our friend and colleague, Ann Roberts, who is a hospital administrator herself, is going to kind of walk us through, like, how are hospitals governed and what are the decisions that are made in the C-suite that affect patient care, patient safety. Then we're going to kind of go into the science of patient safety. As you and I know, patient safety isn't just some patients are the victims of medical errors and others aren't. There's an entire science built around how to implement systems that can root out a lot of errors. So that's going to be super interesting. Then I want to just start taking it apart piece by piece. What's ailing nurses? Nurses are burned out. Nurses are overworked. Why? And what do we need to do to fix nurses so that nurses aren't being put in situations where they are error prone? What's ailing doctors? Doctors are miserable. Talk to any doctor these days. Doctors will tell you the system is crushing them. So why are doctors so miserable? What's ailing doctors? What do we need to do about it? I'm super excited. And in fact, you're going to be one of my guests on this topic. AI is not the future. The future is now. AI is embedded in medical decision-making, medical documentation, robotics, all the way across the board. And in our lifetimes, well, not just in our lifetimes, now It's happening so rapidly. Over the next months and years, we're going to see a rapid transformation in how healthcare is delivered to us. So that's just a general idea.
Well, it sounds very interesting. I know some of the guests you have that are just fantastic and world class in their specific areas. Really look forward to being a guest and then seeing the other guests because it's just a wealth of information that you really can't get anywhere else.
Well, it's been kind of cool as this has developed because one of the things that was unique about the Dr. Death case is that lawyers and doctors came together because there was a common enemy and everyone banded together. And it wasn't, lawyers against doctors, doctors against lawyers. And as the podcast has picked up interest and picked up listeners and viewers, I've been able to attract some really cool guests. And I'm learning how many really fascinating people there are out there who are studying things at such a high level. So that's been really neat. I would say that one of the things of many things that you and I have in common is that we are lifelong learners. And, we preach this to our team all the time that we're under constant quality improvement of ourselves. We're constantly learning and growing. And this podcast is helping me grow in my knowledge. And I'm hoping it'll make me a better medical malpractice lawyer for our clients and a better patient safety advocate.
Well, I know all the viewers and listeners are learning as well. I certainly am, and I really look forward to this season.
I look forward to it as well, and I look forward to having you back as a guest.
All right.
Thank you.
Thank you.